Hello, everyone. Welcome back. In this set of video lectures, we're going to be covering diseases of the genitourinary system. A lot to cover. I think we can fit it in two video lectures, so let's get started. Okay, these codes fall in a range of N00 through N99. We'll get into the subdivision in just a little bit. And again, here are the blocks of them, and you can see them laid out N00 through N08, glomerular disease, N10 through N16, renal tubulointerstitial diseases, and so on. And this chapter includes conditions covering not just the urinary organs, but the reproductive organs for both males and females and breast-related conditions. Some codes require knowing the patient's sex because certain diseases only apply to a certain gender or sex. There's some instructional notes for additional codes, and you can see some examples here. If a kidney disorder is present alongside kidney failure, or if an infection is involved, you may need to code the organism separately. And again, this is another chapter where you need to read the tabular carefully, and you'll be rewarded for your carefulness with the correct code. Some conditions are related to an underlying disease. Chronic kidney disease, CKD, is one of the best examples of this. If the CKD is related to diabetes or hypertension, these conditions must be coded and sequenced properly. Sometimes we also have transplant status that also needs to be documented. We have some important inclusion terms in this chapter, and these help you recognize alternate names or related diagnoses. So, a lot of times, unspecified kidney failure may include cases documented simply as uremia. Benign prostatic hypertrophy may be documented as an enlarged prostate or simply BPH. Again, abbreviations are very common, even with electronic health records. And these clues will help make sure that you are choosing the correct code. You have some other inclusion terms that are worth being familiar with. Chronic nephritic syndrome includes chronic glomerular nephritis. Renal tubulointerstitial diseases include some form of polynephritis. And there's certain gynecological conditions that include broader or related disorders. Understanding what these terms mean will help connect provider documentation to the correct ICD-10-CM code. Now we see our old friend excludes one notes again. Again, excludes one note shows situations where the two conditions cannot be coded together. And for example, certain types of hematuria cannot be paired with cystitis codes because they represent different clinical scenarios. Excludes two notes, on the other hand, identify other conditions that can be coded together with these category codes. And if you think about it, there are two great examples here. N39, other disorders of urinary systems, excludes but can be coded with hematuria. That makes a certain amount of sense. Non-inflammatory diseases of the ovary, fallopian tube, and broad ligament excludes but can be coded with hydrosalpinx. That's a little bit different than NO2, where you can have acute cystitis with hematuria not being coded with hematuria that's not otherwise specified. If something's specified, you can't use it with an unspecified code. And then we have some chapter-specific guidelines for chronic kidney disease, kidney transplant status, and cases where CKD is related to diabetes or hypertension. There's some important rules for classifying CKD stages. Understanding these guidelines will help you sequence the codes correctly and report these codes accurately. And that's all I have for you. Thank you so much for watching, and we'll see you online. Bye now.